Okay, proper bathroom mechanics we want to go over. We want a squatty potty, bathroom stool, yoga blocks, something underneath your feet to get your knees higher than your hips. Remember, this is what opens the rectum itself. It optimally places your organs to empty. So this is helpful if you have any kind of prolapse or any kind of shift in the organs. 50% of us do without having a baby, by the way. So this can really be beneficial to anybody. If you are not fully emptying your bladder, I also recommend this because of that reason. It optimally positions the bladder and the urethra to empty. All right, but especially for bowel movements, I think everybody needs to have their feet up higher than their hips because this is very anatomical. It's not an age thing or always a diagnosis thing. We were meant to go to the bathroom in a squat, and we just don't do that anymore. And the toilets tend to get higher and higher, which is kinking the hose. So we need to tell the muscles of the pelvic floor to go on slack, and that's what a deep squat provides. It provides relaxation of the muscles of your pelvic floor. So if you notice, I am slightly leaned forward. I have my forearms on my knees. I'm leaning forward because this is textbook position for going to the bathroom with more ease, okay? Now, I have worked with people where sometimes we need to do like a little bit of a side to side. Sometimes leaning back helps you get a little bit more progression of the bowel movement. Some people need to do like hip circles, up and down, side to side, diagonal. You can move in different directions while you're here. Doing an O sound, ooh, go ahead and try it. Ooh, you can feel that rectum, almost like the anus opens a little bit, like it's a little bit of pressure going down. That's why we tell you to do it when you're having a baby, right? So it's going to help us empty and get out what we want to get out. So if you are in a position to make noises, you can do O sounds. And I also want to talk to you about splinting. Splinting is a technique. There's two different ways to splint. One is supporting your perineum. If you get some tissue, press up onto the perineum, and that perineum is the space between the vaginal opening and the anus. You are supporting your pelvic floor muscles from the base, which can be really helpful postpartum if you tore, if you're having anal fissures, if you're having a lot of discomfort with bowel movements. Another way to splint is if we insert your thumb vaginally, pad back. Okay, so here is this. The uterus is here, and you insert your thumb and push posterior, which is toward the rectum, okay? Your rectum sits just behind the vaginal canal here, all right? So when you put your thumb in vaginally and press back, you are providing support for the posterior wall of the vagina itself. And when the stool starts to come down the rectum itself, the rectum doesn't have the opportunity now to shift forward, which it can in some instances. We can get a little shift here. We are going to block it so the stool continues to hit that angle in that corner and not continue to go forward. Now we come down and out, all right? So the rectum position matters. The opening, remember those muscles that go around are kind of like that U shape. We can pinch off and narrow what we're trying to open just by changing our positioning. Inhales relax the pelvic floor. They're the gatekeepers. They're going to open the ooze if you need to, the splint also. Okay, so if you have any kind of prolapse, anal fissure, pain with any kind of bowel movement for any reason, the splinting technique is very beneficial if you feel comfortable inserting one thumb back. Now, if you don't want to use your hand, you can use a tool. It's called FemEase, F-E-M-E-Z-E, FemEase. That can replace the thumb. Also be careful with my people with nails, ladies who have big nails. Don't cut yourself. Just go in slow, okay? You can do it with nails. If you don't feel comfortable, you can glove up, or you can just do the perineum press, okay? So these are different options for splinting. Now, when you splint, just so you're not nervous or like unsettled by this, you can feel firm, hard, lumpy stool. You're not actually touching the stool, but you'll feel that it's there. It's not a tumor, okay? It's just your stool that's stuck. So if you have the urge to go, but you can't initiate without pushing, this is a technique to try to get you out of straining. We don't want to hold our breath and strain. You can blow out like you can blow through a straw, or like you're blowing bubbles. This is something also I teach kids. So kids also don't get the bad habits, which now we're in our adulthood, still having some trouble with constipation sometimes. So we want to improve the consistency of the stool with some kind of magnesium citrate or stool softener. But in regards to bathroom mechanics, this is what I wanted to go over with you. Get your feet up, knees higher. It doesn't count if you go on your toes. You are actually activating a myofascial line that runs through your foot and the pelvic floor. This is actually going to contract your pelvic floor. So please don't go up on your toes. It doesn't count. It's not the same thing. Holding yourself up like this does not also count. Obviously, that's muscle contraction this way. I've had some people try to go up onto the toilet themselves, and some say it was fine. They could squat over the toilet or bring their feet up. I think it's straining in a different way, like holding your legs up. So if you have something to put between your feet, or just buy it, these can fold and go under the sink, or you can get yoga blocks and just put them on the side, use them as needed. But I do want you to try to have something under your feet if you're having any kind of difficulty with bowel movements.